Okay, welcome back everyone. Now we're going to go over how to use Image Trend Elite Field. So earlier we showed you Elite, which is the actual cloud server where all your information is stored. Elite Field is what you'll be using on your tablets to create runs, which are temporarily saved on the tablet until you post them, and then they shoot over to the Elite side. So up on the top, first thing I want you to do is save this URL to your computer. Make sure to write it in complete. I'll give you guys a few moments to write down this URL. So these are both already saved as shortcuts on your iPads when you're working. But for training purposes, because you're going to be doing homework from home on some sample runs, we want to make sure you can still sign in. Okay, so first thing you're going to notice is this is a blue sign in. So that's how you're going to know right off the bat you're on a different version of Image Trend. Go ahead, sign in. Remember, same username and password. Once you sign in, the software is going to want to sync, which I already did it a few minutes ago, and it did all the syncing where it's updating the facilities, unit preferences, any updates from EMS. If you're not sure if it did its sync or you want to ensure that it did it, you can go to settings and then sync all resources or changed. So I'm just going to do changed resources just to see if anything's been changed since I last was in. So it's done. If you have any calls on your iPad, if they're not posted, leave them alone. That means a crew probably hasn't finished. So that way they have access to that old run. But since I'm an administrator, I know that that's an old run. I'm just going to go ahead and get rid of it. Once your calls are posted, confirm with the dispatcher that they have been posted and they can see it, then you're allowed to go ahead and delete your runs. So I'm gonna go ahead and start from a fresh screen so you guys can see how to start when it's blank. Anytime you sign in, it's gonna default to the previous crew's information on your device. So this is what it should look like. Okay, crew, hit plus, go ahead and add yourself. You can type in first name or last name so it knows that I'm an EMT. My role, since I'm going to be the one taking care of the patient, I am the caregiver at the scene and the caregiver during transport. This software is designed for everyone to use, from BLS to 911 to even helicopter transports. On a 911 call, for example, you're going to have one agency, which is the fire department. They're going to be the caregivers on scene because they're the ones who show up first. Then they give report to the 911 ambulance company who shows up, and then that person's going to be the caregiver during transport. But since we're non-emergency, we're both the persons responding to the scene initially and transporting from the scene. So we're going to be both of these caregivers. Then I'm going to go ahead and hit OK. Then I'm going to add my driver. For today, I'm going to say the driver is Ryan. And if I didn't know his last name, I can just type in his first, and there he is, Ryan Hartsock. He's an EMT. He's going to be the driver during the response and the driver during transport. And then, of course, if you have a student or a ride-along, you can add more people. If it's just a simple student, I believe it's going to be under the roles. Yeah, you can put intern or other for the other person that's in there. When you do your ride-along, chances are you're going to be that third person, but you're the primary caregiver, and then the other EMT in the back, they're going to end up being the other caregiver, since there's going to be two of you in the back, and then one driver. So just make sure to give the correct roles for everyone. And the software is very easy to use. X's close or cancel things out. If you see a circle with a line through it, that means it's not applicable or not reported. If you see a box that looks like a time clock with a dial, that means when you click it, it'll stamp it to the current time that's on your iPad, or you can click on the time box and actually change the time in case you did it, 5 minutes later. Software does allow you to change your time. So now unit and shift. I click on here, select the ambulance that you're working today. I'm going to stick to one that I know it's not being used, 997. My call sign, that is my shift name that I'm assigned to that day. I'm just going to pick one that I don't think is being used. Advan 32. The role of this unit should be pretty self-explanatory. BLS. The level of care is EMT. And I'm going to hit OK. The schedule or calendar box is just another way to put the shift that you're working. Some companies do their schedules different from their call signs. Here at Advantage, the call sign is the same as the shift assignment. So you're just putting the same information twice. Medical devices. We're not going to be using this for the time being. If we had, all our tablets that we use are Apple. So if we had an Android device, since our Zoll monitors that our nurses use have Bluetooth, you would be able to Bluetooth connect that monitor to your tablet by going in here at the start of the shift and finding which monitor by a number that would be on the monitor, so you can connect to the right one. So later when you're in the software, there's an EKG button that you can hit, and it'll sync the data between the monitor and the iPad, or excuse me, the tablet. Apple products don't like to share data, so unless you have the new fancy X series Zoll monitor, they won't transmit anything. So this box is just not being utilized at all right now. Okay, we have all the basic information. Go ahead, hit new incident. Now it's going to take you into image trend to create a run. So first off, I'm going to do is just give you a basic overview of what we see here. On our left are all our main tabs. Underneath each one of these is a submenu. It could be from 1 item to maybe up to 8. The way the software works, it's an algorithm-based system. When I answer a question in this tab, it'll change tabs below it, and vice versa. It's going to take boxes away. It's going to add boxes. But the whole idea is you're going to work through the software going through these tabs from top to bottom. And the nice thing is if the software asks for a question in one place and the question is later asked in another, it will auto-populate that other field for you, so you're not having to do it twice. Down here at the bottom, it says no patient name, of course, because we haven't gotten that far yet. In the middle, currently, my validation, I am 54 points out of 100 done. So if I click on this, if I were to add up all these points, plus the ones that you can't see, it'll equal 100. So when you think you're about done, you should be somewhere in the about 90 points, 91 or 92. Go ahead and click on the validation button. It'll tell you exactly which tab you're missing information on, so you can get to 100% or 100 points and then be able to post your run. The button next to that, menu. This is how you add your attachments. So you're just going to hit attachments, add, and you can do attachments one of two ways. Since you're using an iPad, when you got on scene of the call, you could have had the camera on and you could have preemptively started taking pictures of your face sheet, your certificate of medical necessity, otherwise known as a PCS, physician certification statement, and then also take pictures of your H&P. So remember, for any non-emergency call, those 3 pieces of information are mandatory. So number 1 is a face sheet, 2, you need your PCS or CMN, and then number 3 is what's called an H&P. That's the history and physical. It's a summary report of the patient's admission to that facility. And so when you read that, you're going to get a lot of pertinent information from that patient. And you're going to either, like I said, take the photos, and then you're going to be able to go to browse, go to your photo gallery, add them that way, or you can hit take photo. See, my camera on my device is not turned on because it's a laptop. But your camera will be on, and you can take photos live inside of Image Trend. Now, photos taken inside of Image Trend via the Take Photo button only save to Image Trend and are encrypted. If you were to have taken it from your camera, those are not encrypted and can be accessed by anyone who has access to your iPad. So at the end of your shift, make sure to delete your camera roll, because everything's been posted. You no longer need those attachments. So let me hit cancel. And that's pretty much the only thing you'll use the attachment or the menu button for, is your attachments. Over to your right, you will see the status of the call. Currently, it says that I am in progress. Please get in the habit, as soon as you start a new run, hit the down arrow, switch this to, where is it? Ready for billing. The ready for billing button, once you post this call, will let the readers know that this is done and can be downloaded by anyone. If you were to post it and this was still labeled as in progress, no one can see it. It's just the call does not exist. Only you as a provider can see it, and maybe myself and Ryan as administrators. So just make sure, if you were to accidentally post it, well, you're going to have to then go back in, reopen the call, change the status, and repost it and overwrite your previous one. But just make sure that always says ready for billing. These blue tabs here on your right are shortcuts. We're going to go over the main shortcut later today, which is the assessment. This is going to be your best friend when it comes to assessing your patients. Up on top here, as we keep going, you have a jot pad. This is a new feature that just came out this year. The jot pad is designed like a post-it where you can simply sit here and take quick notes where you don't want to maybe jump through the iPad to put your notes down. Maybe it could be vitals, a report the nurse gave you. The only thing is a jot pad is not saved. Once you write something down, make sure you transcribe it somewhere else in ImageTrend where it belongs, because once this call is posted, if you forgot to erase it, it doesn't matter. It will automatically be erased. So I don't even know why they have an erase button unless you're taking lots of notes and you need to make room for more. Timeline. Right now, we're going to do a fake call, so there's nothing really to list here, but this will show you all your timestamps in chronological order. So at the end of the call, if you have an error and it's time related, you can see where it needs to be moved to by this incident button or timeline on the incidents. Next, we have mileage, where you're going to put your starting and ending odometer once you get on scene. Starting odometer will always be the last 2 digits of your odometer, then point and whatever the 10th digit your odometer is currently reading. So when you get to your destination, write the same thing, your ending odometer, last 2 digits, point 10th. So it shows I went in, 1.6 on this example. So let me just delete that because we'll come back to that when we do our fake call here in just a moment. Next is your time button. This is going to be completed at the end of the call. Once you clear, dispatch will page you with all your times, and then you just go in. Your validation is going to go from like 91, 92, all the way to 100 by adding these times. So up here at the top, to finish this off, we have our close button. This closes this EPCR. You have the transfer button. This is if you have a problem uploading your call, you can transfer this run to another device. Another time that you would transfer to another device is if you upgraded to 911. You can push this and select which unit. So I'll give you an example. Since it's on our tablet, we want to upload it to the cloud. Select the other company that's on scene. So all the companies in San Diego are in here. Once you've done that, let me say I put Air Care, for example. Then select what unit that they have on duty today. And so this is an example of all their units right now. Once you've done that, you're going to say, it says, would you like to remove this incident from Elite Field after transferring? You're going to say no, transfer and keep, because you want to keep a copy so we don't lose all that data. And then Air Care, what they're going to do is they're going to go to their tablet about 60 seconds later, hit transfer, they're going to hit download, and they're going to find whatever run was sent to their company. Since you picked their unit, they should be easily able to find it, download it, and everything you did on your tablet now populates their tablet, which makes it a lot easier for their documentation. Next to that is that EKG button that I mentioned. So the day that we're able to connect our monitors, this would be the place that we're going to do that, to download that data. Print and PDF, we're going to show you this at the end. It converts your web version of ImageTrend to the version that comes out to billing and any other providers when they download or print what this looks like, because it's not this nice pretty format. It's just one long continuous PDF file. Post, again, is a fancy word for uploading to get the call off your tablet and onto ImageTrend Delete. And then, of course, you have your save button. As you go from tab to tab, it does save. Every 5 minutes it saves, and it saves if you hit the save button. Okay, so now what we're going to do is walk you through doing a fake run. You can follow along on your computer or just watch and then later make an attempt yourself. So everyone has a pager. Dispatch is going to assign you your call via the pager. Once it goes off, it's going to have the run number, the pickup, the drop off, the patient name, and any special notes that we were told from the facility. With that information, you can start filling out your paperwork. So that way a lot of these boxes are filled out in advance. This software, all the red that you see are required fields. These are not Advantage's required fields. These are the state of California and San Diego County EMS required fields. There are certain data sets that they want to collect each and every time. In order for a call to be billable, just letting you know right now, you're going to have to go beyond the red and there's going to be sections in blue that if you were to skip, your call most likely than not will not be billable, and you're going to be getting these calls sent back to you to fix, which in the long term will affect your evaluation and scores towards rewards programs or incentive programs that we have because your runs are not billable. So the whole idea is once you post this run, if billing was on same day processing, they could literally download the call and start processing it. The way it works now is the next day they're downloaded and then they're checked. And so it can take up to a week to verify if the call is billable before billing actually looks at it and then maybe emails you back to fix your run. So the first thing we're going to do here is we're going to hit the incident button and put in our run number. So since we're putting a fake call, I do ask that whatever date you are doing this, put that day's date and put in practice. So number one, I can find what day you did it, and anybody who reads this knows it's a fake call. Once these are uploaded, EMS can see it as well as our billing department. So we want to make sure we're not, making people think that we ran more calls than we did, or that these calls are billable when in fact they're not. The next thing you're going to do is figure out the number of patients, which should be single. And you notice once I've done that, it changed my screen a little bit. At this point, we're ready to move on to the next tab. This first tab here is a summary of the entire call, and it expands as you fill it out, but it's not designed for you to work on it. This is just where all the data goes. So you're going to go to the next tab down. So here you see, after we clicked on run, that the crew information is blue. I'm just going to quickly scan it to make sure everything's filled out. Now I'm going to go to incident. So agency response number, we don't have one of those, so you leave that blank. We just have our run number. Triage tag, it's not a MCI, so we don't need to put a triage tag number. And you see some of the stuff that we already filled out earlier has already populated in. So now we're on response mode, so it should be non-emergent. Additional response mode descriptors. So all the correct answers are what you're going to want to mark. So if this is a regular non-emergency call, we have no lights and sirens. We have, where is it? Speed normal. And is this a scheduled or unscheduled call? If it's off the floor at the hospital, those are always scheduled. The ones that are usually not scheduled are your calls going to the ER or ER to ER. So any kind of medical emergency or is going to be your unscheduled. So I'm going to go ahead and mark scheduled. And there are no other intersection lights, no normal, nope, with normal. Oh, here we go. Intersection navigational with normal light patterns. So these are the 4 normal buttons you should see marked. And you scroll down. This isn't a medical emergency, so we don't have a complaint reported by dispatch because the patient will have a diagnosis. Are you the first unit on scene? You're always going to mark yes because we're not part of the 911 system on these calls. So we just want to mark yes there, no EMD, and nothing else for this tab. Next is the response information. So patient's disposition. So here's what we're going to tell the software that we actually transported a patient. And you're just going to scroll down. You're either going to be picking BLS interfacility transfer or medical transport. So those are your medical aids, or just, like I said, the non-emergency. Or it's going to be a CCT transport. It's only one or the other for you guys. Okay, so I'm going to pick BLS. Then over here, I'm going to pick medical transport, BLS. Location type, we're going to say we're picking up the patient from the local hospital. And then you have the option. See how it's not red, but the hospitals are built into the system. So if you find a hospital, and we'll say Paradise Valley. So now that I picked that, when I get to the next page for incident address, it automatically knows the address for Paradise because we picked from the drop-down menu. If you run into a situation where, let's say, for example, you're picking up from a nursing home. Let's go back up. Let's say nursing facility. You have to manually type in the name. So Castle Manor, for example, which is down the street from Paradise. When I go to incident address, I manually have to put in the address. So you're going to put in the street address, then do zip code, and then find your zip code, and it'll put in the city, county, state, and country for you. So again, manual addresses, street address, zip code, set from postal code, find the zip code, and then it'll fill out the rest of these. Okay, so I'm going to switch this back to a hospital type call because those are the common ones that you'll be doing. And those will be also the ones that we're doing in orientation. So it has the address on here. The only thing that's missing for billing purposes is incident, apartment, suite, or room. For all insurances, you must identify that on this property address or incident address, where was the patient found? This must be filled out. So it's as simple as putting, ER, bed 2 or bed A, or if they're up in the ICU, which ICU bed, or the actual room number, whatever that may be. Okay? Now, what if the patient was picked up from a private residence and this was their home address up above? Well, then for the room, just simply put where you found the patient. Were they in the bedroom, living room, the garage, the backyard? Maybe the address was a city park, okay, and the resident or the person you found was in the baseball field. Okay, so the whole idea is just, guys, please identify, you have an address, where at the address specifically was the patient found. So let's go back to just a room number. Reasons for a delay. Now, this will not turn red ever until you've put in all your time, so the software can calculate how much time it took you to respond, how long you were on scene, transporting, or if you had to wait return, how long it took you to return. The software is using time rules from 911, so if you were on scene too long, this may be red, and then you're going to have to tell the software, wait, I was there for 20 minutes, but I wasn't delayed, so then you're just going to have to select none, no delay, and trick the computer that, the answer that it wants isn't the correct one, and actually you had no delay. So, and we'll show you that once we get to the end and we put in some times. So before I continue, I'm going to pretend I'm doing a real call. So I'm going to go over to times. I'm going to say dispatch took a call this morning at, let's say, 12 o'clock. I was dispatched for this call at, we'll say, 12:30, and I went en route at 12:33. I got on scene, so it took me a little bit to drive there. I'd say I got on scene at 12:45. And then it takes you some time from when you park the ambulance to get to the patient. The only time stamp that you are marking is when you get to the patient's bedside, hit this little clock. So see right now how it's 2 o'clock, it put 14:17. But we'll say it took me 12 minutes to walk over to the patient. So I'm going to say 12, 45, 55, 57 is when I made it to the patient's bedside. So that would be my time that I do, because all these other ones are coming from dispatch at the end. But since we're faking the call, I'm just trying to show you guys that you need to be in chronological order. Then I'm going to close this, go back over here. So now my next tab down, we have times there now. So let's say no delay. There we go. Patient information is next. So we'll make up a name. We'll say Donald, last name Duck. We'll make up a birth date, 12/30/79. So Donald Duck is 40-year-old male. So if there are months or days, you can change that. Okay, so once you have his name, year, age, if it's a minor, you can mark if they have a guardian. Next is their gender. So Donald is a male. Race, whichever race they are, or if they don't want to identify or you don't know, you can hit not recorded. But I'm going to say Donald is white. His weight is 150 pounds. It automatically converts to kilograms for you. If this was a child, anyone under the age of 14, after you put in their body weight and it converts to kilograms, the Broslow color tape will even pop up. Okay, once you've entered in the race, the weight, if it's a pediatric patient, Broslow color tape will pop up. Driver's license, not required, not needed. This is for 911. What we do need is a phone number or email. Our billing department needs to be able to reach the patient. Most of your face sheets will have the phone number, or the patient will have a phone number they can give you. So make sure to put that in. So I'm just going to put in all fives. The next important information, again, it's not red. The county doesn't require it. The state doesn't require it, but we do for billing purposes, and that is a Social Security number. Without that, we cannot verify the patient's insurance. So it's vital that you get the social. All you have to do, if it's not written on the paperwork, ask the patient, hey, sir, hey, ma'am, what is your Social Security number? And if they ask why you need it, it's so that way our billing department can verify your information, verify your insurance, and so we can properly save your file in our database so it's assigned to you. Because once they sign the consent form, you have the right to that information anyway. But if we hadn't ended up having to get it from the hospital, it takes us days, if not weeks, to get that information from medical records. So do your best to get the social while on scene. So for now, I'm just going to put all 9s. Next tab, patient's address. Your face sheets that you get for these calls and you've taken a picture, sometimes a crew takes a very blurry picture. It could be fuzzy. There could be many problems. It doesn't upload. You still need to put in manually your patient's address. So billing doesn't have to rely on that face sheet. Having the name, having the doctor, which we'll get to that in a minute, having the social and a contact number and the patient's address, we can figure out their insurance if we need to, if you lost that face sheet. Especially we can also mail the patient a letter or a bill or whatever it may be. So for the address, like I told you before, put in a number, the street, put in a zip code, then hit set from postal code. It's going to know the city, the county, the state, the country. Makes it easy. Now, if the patient lives in an apartment complex, then you can put the apartment number right there. Okay. Moving on, history. Reading that H&P or looking in the patient's chart, you can write the patient's history down. If you type in some abbreviations, it may help you find certain words. Otherwise, you may have to type them out. Like diabetes is DM, but that didn't do anything. But if I start typing DIA, there we go, diabetes. So see if their medical history is in the list. Whatever's not on this pre-built list, then you can free type it down here. Okay, so I'm just going to add, for example, like UTI is not on the list. And I'm going to scroll down. Where did I get this medical history from? The healthcare personnel, because they're going to be handing you, there's not a tab for chart, but you're getting it from the hospital staff or the chart. Maybe the patient too. They're alert and oriented, and you ask them certain questions, and they're giving you answers. Again, if there's more than one correct answer, mark them both. Next tab is allergies. Are they allergic to anything? There's a long list in here. If they have no allergies to medication, remember that line, the circle with the line through it? Find the no known drug allergies. Same thing for environmental. If they have none, it's right here. Now meds. Notice meds is not in red because the county and the state don't need that data. We do. One of the things you're doing with ImageTrend, every time you enter a patient's information, you're creating a record in the database. When you go in for a second time for a certain patient and their name and their social and their date of birth matches someone already in ImageTrend, you will have the repeat patient literally lighting up. Or if it doesn't, click it anyway, which is on the patient information tab. Where is the repeat patient button? Oh, I think because I already went past it, it doesn't show up. But there's a repeat patient button. And if Donald Duck had been in the system before, what would happen is I select yes, download, all his history, all his meds, all his allergies, everything about him that you've already entered will pre-populate your iPad. So you just saved yourself a whole lot of work because another crew did you the benefit of entering in good information that is able to be downloaded. So very, very important, do add your meds. I've never run into a patient going to a nursing home because they're going there for long-term care that didn't have an underlying medical condition that required some kind of medication. The only type of calls I've seen where they don't have meds is maybe a young person going from ER to ER, and because they're young, they don't have any chronic conditions yet. So, but otherwise, you should be listing something. Okay, but just for the sake of this example, I'm just going to put none reported, and I'm going to move on. Patient physician. In order to bill a patient's insurance, we need to know who the doctor is. Every patient's insurance plan lists their doctor by first and last name. So look at the face sheet, look at the transfer sheet. It's going to be on one of those sheets. They can't transfer a patient without the doctor's name. So make sure to put it down, but it needs to be the doctor's first and last name, because there could be more than one Dr. Banner, and we're not going to know which one's associated with this patient, and that's needed for insurance purposes. The next tab is the DNR. So if your patient has a DNR, which one do they have? Is it a one that the family has? They have a living will? They have a post form? It's an advanced directive, or they have a none. So please identify their DNR status. It's very, very important. If you happen to have a DNR, take a picture, add as an attachment, so it's part of our record as well, just in case something happens. Next tab is the assessment. So here we're going to put the chief complaint, or in our case, because remember, this software is designed for 911. If you're taking a patient out of a hospital, it's not a chief complaint anymore. It's a diagnosis. So I'm going to hit add. It's the primary complaint. So I'm going to say, for example, the complaint is pneumonia. Can't even spell today. Duration of the complaint. Do you know how long they've had the pneumonia? Maybe they've had it for the last, 5 days. So you can give a time frame, or you can just hit not applicable. But his complaint going into the hospital would have been maybe shortness of breath, wheezing, difficulty breathing, rales, rhonchi. Those would be the symptoms that you would list if this was a call going to the ER. But now that those symptoms have been addressed and he's been diagnosed with a medical condition, it's the diagnosis that you put down under complaint. Now, a lot of patients are pretty sick. They could have more than one. So I'm going to hit OK here. So if he has another diagnosis when he's leaving the hospital, you can hit add again, do secondary for the other diagnosis, and then list whatever else he was diagnosed with having. Maybe this guy also had urosepsis. So he had a UTI and it was really bad. But we don't know how long he had that one, because he maybe had it for longer than the pneumonia. So then you can put not applicable. So boom, now we have a primary diagnosis of pneumonia, a secondary diagnosis of urosepsis. If your patients are so sick they have more than one or more than two, just go back, hit add, and do other, and just keep adding more. Chief complaint location. So this pneumonia, where is that located? That's easy. That'll be the chest. Which organ system? That'll be the pulmonary. Patient's acuity. So when you found them, were they critical? Were they moderate? Or are they lower? Usually they're going to be lower. Please make sure they're not dead, or unless they are dead. I've had a crew member once who went to go post a run, and it was asking for a cardiac assessment, and we figured out the reason being he accidentally marked this button instead of this button. And so the software didn't know what to do. So just make sure you're marking everything correctly. Which protocol did we follow? Well, this was an adult that we picked up, and we can say we followed our basic adult and pediatric skills. Okay, or you can even say standing orders. Or you can find a particular one in here that matches. But if you want to just put the basic skills one, that works for me. Primary impression. Impression means like you're implying what the patient might have, or you're diagnosing them. Well, these patients have already been diagnosed. That's why they're leaving the hospital. So you just hit the circle button here, and it says not applicable, including BLS transport only. That's what we're going to mark. Now, he has pneumonia. What if he still has some symptoms when we pick him up, even though he's being treated with antibiotics and maybe some breathing treatments? So if he has any additional symptoms, like maybe some wheezing, you can add any symptom. So pick the one symptom that he has that's the most severe. If he has other symptoms, you can add them down here, whatever they may be. So for example, I gave this guy wheezing and fever. But that's up to you based on your assessment. Barriers to care. Is there anything that kept you from caring for the patient? If there's none, then just mark none. But you have on here altered level of consciousness, dementia or Alzheimer's. There's all kinds of things on here. So you just pick whatever's appropriate, but usually you're going to mark none. Was there any drug or alcohol use on this transport? Most likely not. So just put not applicable. Was this work related? Probably not. So now I go to the next box, which is my assessment. Was there any possible injury or trauma? No. Cardiac arrest? No. Stroke? No. STEMI? No. And then I got my primary assessment and my secondary assessment. So with your primary, this one, it's easier just to do it right in the app without having to go to the shortcut. What time did you take the vitals? So now let's look at what time we got on scene. So I'm gonna hit cancel real quick. Since this is a fake call, I want this to be in chronological order. So we got on scene at, we said 12:57. So we'll say, or not, patient at 12:57. So we'll say we got our vitals about 5 minutes after getting on scene. So we'll say 1:02. Okay, so I just need my initial set of vitals times. So I'm gonna click off, go here, and then put the time. See how it says 15:11? So I can go back and say it's 13:02. There we go. So we got our first set of vitals, airway, patent, respiratory, normal, pulse, we'll say it's normal, GCS, AVPU, he's alert, heart rate, we'll say 60. Was it auscultated or was it on the pulse ox? We'll say it was on the pulse ox. His respiration, 16. So whatever your patient's vitals happen to be, just go ahead and write those down. BP cuff, was it automated, meaning the machine? Auscultated, you did it manually, or maybe you did it over palp. So we'll say auscultated. All of these other ones don't pertain, so we're gonna skip those except for pulse ox because we put him on there. And we'll say it's at 95. We'll say the patient is on oxygen. Blood glucose, we said he was a diabetic, so blood sugar is an important vital sign, which you are required to either have the staff tell it to you so you can document it, or with the new protocols, you are allowed to obtain one yourself. So we'll say we'll check it and it's 90, so that's normal. Pain scale, if he has any pain, put a number. If he has no pain, identify it with a 0 on a 0 to 10 scale. So we know that you did a pain assessment. If you just said it was not applicable, well, we don't know that you actually asked if the patient had any kind of pain. So we want to make sure that you document that. If they do have pain, you have your OPQRST here that you can fill out. Temperature, if it's appropriate. And then once you're done, that's it. So hit OK. And there's my first set of vitals. So now we did our secondary assessment. So you have this long way here that like this one was top to bottom, but the assessment and the power tool here is very intense. So we want to use the shortcut. So we're going to go over here where it says Assessment Plus, use this one instead. Now at home tonight, try this one out and just see how long it is. I don't need to record it because it's so long. So I'm going to hit the shortcut. I did my assessment. My vitals were at 13:02. We'll say at 13:04. You're going to start by saying everything is normal and then work on the areas that you actually have results on. So let's start with my chest because he was a pneumonia patient. Unclick normal. See how it changes the color here. So it's going to show up on your assessment. I did my lung sounds, and let's say he has some pain when he breathes, maybe some bronchi on the right with some, and wheezing. Let's see, anything else? Wheezing, expiratory, so we can say it's also on the right or maybe on the left. So the whole idea is you can mark whatever you want because all of these are pertinent questions or answers that have to go with the chest and the lungs. If there's something you want to state that's not here, go to details and then start typing out what you want to say that relates to this area. And then just hit another area. Let's say when we pick him up, he happens to have a saline lock in his arm like a lot of patients have. So I'm going to go to forearm. We'll see it's on the right-hand side. Well, the arm is normal, but I'm going to unclick it so it shows it there. And I'm going to go to see if it has my medical adjuncts. It doesn't have the option, so I'm going to manually type it in. Saline lock, right forearm intact, no bleeding or obvious signs of infection. So you got to describe all your medical adjuncts, where they are, what are they doing, and what's going on with them. So that's what I just did right there. Any other area? Maybe your patient has a Foley, because a lot of our patients do. So you're going to go to pelvis. Oop, where'd it go? Pelvis. And they don't have a Foley, so I can go here, details. Patient has a Foley. Foley was drained. Let's say 400 cc dark yellow fluid reported to RN. So if you feel comfortable emptying a Foley catheter, you can go ahead and do so, and then just make sure to let the staff know how much fluid you drained out, because some of them are recording the patient's fluid intake and output, and so they might want to know that. Sometimes they'll tell you, oh, okay, thank you, bye. But at least you can document that you did it and you took care of that Foley. Because if you have urine in that Foley, once you put it between their legs for transport, that urine is sloshing in and out of their bladder, and you will cause a urinary tract infection on that patient if they didn't already have one. So, saline locks are normal things that we document. Foley catheters, chest and lungs, even if it's not relating to why you're there, your patient could have wheezing or who knows, what's going on. But just identify what's going on with the body. Anything physically wrong with their body, identify it. Heck, you can even go to mental status and put, what's going on. If it's not normal for them, you can tell us that they're confused, but that he was normal. Or do a neuro assessment to show us that he's had like a stroke. So these boxes will greatly help you when you have time. Spend some time at home clicking through these and just seeing what's in each one of these. So the day you need to use it, you're familiar with it, which is why I'm also recording this video to kind of help you out in advance before you come on duty. So now we are on, let me scroll down. Oh, this is red. Why is this one red? Document the patient's pelvis GI status. So let's go back to the assessment. So it opens up the long way if you make a mistake. There it is. I didn't document anything. Let's leave it as normal. There we go. And it's not red. Okay. Now for my narrative. Now for your narrative, we want you guys to use the chart format. CHART, which stands for Chief Complaint, or if it's a discharge, diagnosis. History, and we want pertinent history. Don't just rewrite all the history that's already in the history section. What I'm looking for are any conditions that the patient have that are chronic that are still affecting them today. An example, COPD, because the patient could be requiring oxygen, or maybe CHF, because that requires that you sit the patient up. Maybe the patient's a diabetic. Well, that requires that you check a blood sugar. Maybe patient has a isolation or a infectious disease, which requires that you do isolation precautions. So any chronic conditions that require you to care for those, as well as the patient's medical diagnosis, are the ones that we want you to focus on and list. The A for your assessment is where you're listing your initial, your primary, and your secondary assessments, followed by your treatment plan. What did you do for that patient? How did you take care of them? And then finally, T, the transport. How did the trip go to wherever you went? So I'm just going to briefly type out a narrative to give you an example. So we had a pneumonia patient. We picked them up from the hospital, and we were taking them home, if I remember correctly. So I usually start with a little story or introduction to my narrative, because what it is, you're telling a story. You want to have a good intro. So Advan 32, I believe is what we were. And I apologize if I had that wrong. Advan 32 responded to Paradise Valley room. I don't remember what room number we did. I think it was 1, 2, 3, 4. For a 65. No, wait. What did I put? 40? 40-year-old male with diagnosis of pneumonia. Patient went to ED via 911 5 days ago due to severe difficulty breathing, coughing, and fever. Patient is now being released to a SNF for IV antibiotics and rehab. Okay, so on your transfer paperwork, it'll tell you why the patients are going where they're going, and that's a good thing to add to your story. So I have my basic little introduction, what's going on, what kind of call, what happened, and now I'm going to dive in a little deeper. So patient history of diabetes and blood sugar checked by staff and was within normal limits. At, let's say 90. Patient also history of UTI and has a Foley in place. Crew drained Foley using sterile technique and notified staff of 400 cc output. Foley secured between patient's legs. History, what other history did we say? We said it was hypertensive, diabetic, and that was it. And UTI. So now we discuss those things. So now the assessment. Patient was found in bed, semi-Fowler's, and no acute distress on O2 at, because I said he was on oxygen, at 2 liters per minute via nasal cannula with O2 sat at 95%. Patient, let's see what else about my assessment. So patient in O times 4 with vital signs within normal limits as noted. Patient, what else? Lung sounds, wheezing, and patient already had a breathing treatment and next one not due for, 2 hours. So the whole idea is do a full assessment. He was a respiratory patient, so I asked the nurse, pertinent respiratory questions, found out he's on oxygen. What's his saturation on oxygen? Why is he on it? Well, because he's got pneumonia, he's got wheezing, he's been getting breathing treatments. So then you want to find out when was the last one, when's the next one, so the nursing home knows when to give him his next one. So anything that may be pertinent. Let's see what else. We got the Foley, we got the IV, we got the O2, and lungs. Should be good. So assessment. So patient moved to gurney via draw sheet and secured. Patient placed semi-Fowler's, not flowers, Fowler's, and secured gurney. So tell us how you move the patient to your gurney and make sure to add that you secured them, whether you secured them with all seatbelts, 8-point restraint harness, patient fully secured. Tell me something, because I know that you seatbelted and buckled in that patient to your gurney. And then how do you place them? Laying flat, sitting up? Did you have to sit them up? Tell me what's going on during the call. O2, and continued at 2 liters per minute via nasal cannula on portable. Patient transported to, I'll say Castle Manor for rehab and IV antibiotics. RN says patient still has a week's worth of medication to be given. Okay, that's why they left the IV in, because he's still getting that medication. Okay, so now he's being transported over there for that. Patient transported without any change or complications upon arrival. Patient placed in bed with bed lowered and rails up. Now you notice my spelling errors. You have an iPad. You can go back and do a spell check. The other option you have is you can actually dictate your entire narrative. You don't have to type anything. Just make sure to go back and do a grammar check. Okay, so patient transported without any change or complications. Upon arrival, patient placed in bed with bed lowered, rails up. Report given to staff and care was continued. So make sure you document that you transferred over that care. So your basic narrative should have at least 5 sentences, and I have 1, 2, 3, 4, 5, 6. Because you want to give a good amount of information, because this is a summary of all the key highlights of the entire call. Okay, so now I'm going to go to transport. Transport to the scene, non-emergent, no lights and sirens. Intersection against normal, no, with normal light patterns. And speed and traffic normal. There we go. Transport method, ground ambulance. He's still green. Transporting agency, Advantage ambulance. Unit number A32. And nothing. Number of patients transported by this unit, 1. So now I'm on destination. Where did we go? Was it a hospital? No. Closest hospital name? No. Reason for choosing? Why did they go there? Family request, maybe? Specialty facility? None of those apply. Type of destination? Nursing home. Destination name. So here's where you can put Castle Manor. And you notice it's not in the drop-down menu. Oh, so it won't let me. Oh, here's where I put it, down here. And I wrote it once before, so there it is. Okay, so next is address. So I'm going to quickly Google that. You guys would have your facility guide, and you're going to know what it is. There it is. All I need is that. Zip code 91950. Paste 91950. Set from postal code. Boom. Now, there is no place to put a room number. Well, address number 2 is where you'd put it. Room 150. You know, whatever you put the patient at that facility. So now billing knows we went to a nursing home. They have the address, the room number, and all the important information. My odometer. So when I left, whatever my odometer was till when I got to where I went. So for your homework assignments, you know what? Let me make this a little more realistic. Google Maps. We picked up from Paradise, right? So there's Paradise Valley. Our destination was Castle Manor. See how close it is? So it shows we went 1.4 miles. So I'm going to come up with 2 numbers. $1.4 miles. Because we charge by the mile. So that way billing knows how far you guys went. Okay, so valuables. Did I have any belongings? Sometimes you'll have a cell phone. That's the most common thing nowadays. Cell phone. We'll leave it at that. Who did you leave it with? Let's say I left it with the patient. If you want to give any notes, you can. The same thing there. So now I'm on billing. With the billing tab, we know that the face sheets are usually incorrect. As long as we have all the right information, we can research and find the right insurance. So there's not much you're going to have to do on this tab. In fact, nothing at all. Transport indicators. Why did the patient go by ambulance? They were transferred for rehab, transferred for the benefit of a doctor, transported for the nearness of family, transported for the care of a specialist or available of certain equipment, or patient was transported to the nearest facility for the care of their symptoms or complaints. So this one could, for rehab, it could be that and that. It was the closest rehab that can take care of them. So again, if you have more than one correct answer, put them all. Any of these other ones apply? Because a lot of times, nope, nothing else applies here. So now I'm going to go to medical necessity. Did you have these CMN? If you did, great. Take a picture, attach it. If not, you can kind of build your own in here by answering all these questions. but it still needs to be a signed statement from the sending facility. So like your best bet is just get the CMN from the hospital and then take a picture and upload it. So for insurance, remember I said the face sheets are usually wrong, so you're going to leave that one blank. Consumables. What equipment did we use on this call? At minimum, you should be marking linen. So we got linen, which is the blanket, the stretcher sheet, and pillowcase. So we got one of those. Then we're going to hit add again. We use something. We use the pulse ox. So we can add that as well. Next tab, alternate address. We never put anything there. Same thing for closest relative. Same thing for next of kin and for employer. So now we're down here for signatures. So one of the signatures you'll want to get used to doing at the beginning of the call, once you're comfortable with the tabs, is the patient signature, because they have to give you consent to treat and transport, and they have to acknowledge their HIPAA information because you're getting access to their private information. So the patient's going to sign. You hand them the iPad, have them sign their name. You can put the time when it happened, and you can put get name. I'm going to hit OK. Now, before I get any further, I forgot to put some more times. So we left the scene. We'll say we were there for 20 minutes, so 13:20. It took us just 10 minutes to drive down the street, 13:30, because we got every red light. Transferred care off our gurney at 13, we'll say 40, just 13:40, there we go. So it took 10 minutes, and then we're not clear yet. So 13:40 is when we transferred care, because that signature is going to be important. Okay, so we'll come back over here. We have a patient signature. Now we need the receiving facility signature. So when you get to the destination, you want to sign that they've taken over patient care. And we'll say it was Betty White. So you transferred care to them at 15:40. Oop, was it 15:40 or 13:40? I think we had 13:40. Then hit OK. Then this is still red. You have one more signature to go, because that one's gray, that one's gray. Hit add again, and it's going to be crew signatures. So I have to sign it, testifying that this is all true and correct information. And then we're going to correct this and say this happened at and I can do that at any time, so I'm just going to say 1300. There we go. Hit OK. We have all our signatures, all the red's gone. Okay, so now I'm going to go down. Any AMA? Nope. Any controlled substances? Nope. Anything to report? One of the things that we need to make sure you guys are all marking, because we're in the middle of this pandemic, and that's when this is being recorded, is hit add all crew. What did you wear during the call? Of course, everyone's always wearing gloves. But right now, because we don't know which patient can actually have respiratory illnesses, we're making you wear masks at all times. So you're going to mark the N95 mask. Then, of course, if you wear anything else above that, you can mark that. But otherwise, it's those two. And then, was there an exposure? No. Suspected EMS work-related exposure, injury, or death? No. The type of work-related injury, death, or suspected exposure? Should be none. Oop, not other. None. There it is. Then, same thing for me. Gloves, N95 mask. No exposure. No death. And this wasn't even red, but it's important to know that I wore gloves and, I forgot to hit OK. And that Ryan wore gloves. So we have gloves and mask, gloves and mask. Okay. Receiving hospital, not pertinent. Request reviewed, nope. Travel information, no. PCR, no. When taking photos, so these are questions that I added to remind people to do certain things on their calls. When taking photos of documents, did you make sure that all were straight, not blurry, clear, and bright enough? Yes. All calls, did you remember to attach the entire face sheet? Because sometimes when you guys take a picture, you're cutting it off. Non-emergency, did you remember to copy all the pages of the H&P? Yes. Non-emergency, a PCS is required. Did you upload a PCS? Yes. Now I'm at 86. So let's click it. We're missing complaint reported by dispatch, estimated timers of symptom onset, any on-scene delay, available time, back in service. So now we can go back and fill in some missing information. Complaint. So now this wants this on here. So we'll say the complaint reported was, here it is, interfacility or a transfer. That'll answer that question. And that should be pretty much what you always mark. It's going to make it red if you skip it in the beginning. So just when you're going through it the first time, just go ahead and hit the transfer. Reasons for delay, on scene, none. Now for my assessment, the estimated time of symptom onset, not recorded. So now I'm at 94. Available, back in service. So let's go to my times. So after we gave report and transfer, let's say we cleared this call at 1400. So now we're clear. My validation is 100%. Now this call can be posted. Now this is a fake call, so I'm not going to post it. You know what? I will, so you guys can see what it looks like. So hit post. You're about to post this incident. Mark finished on the post if you would like to mark this incident as finished. Marking the incident finished means you're done entering all the incident data. Yes, because it's a training call. And it'll save it. Cool. Please provide the reason PCR was updated. Well, it really wasn't. PCR was not updated. PCR timed out while it was being generated. This is just a practice ePCR. Then you could have closed it right there or hit close here. And it takes you to your home screen. And if you look, it'll show the incident number posted with the blue cloud and the little check mark. And you have a date and time stamp with a green check here. So you know it's been posted. Before you delete anything or go home at the end of the shift, double check with dispatch that all your assigned calls have been posted. And if you have any questions, go ahead and email me. Or talk to me at some point and I'll gladly help you out. I'm always available, or so is Ryan. Thank you.